In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Chronic kidney indispositions are growing increasingly common. More and more people are now suffering from one. That is a problem with a kidney condition often go largely unnoticed for a long time. With me now in the studio is Dr. Martin Kuhlmann, head physician at the Vivantes Clinic here in Berlin, in Friedrichshain, and a kidney specialist. Thank you very much for coming, Dr. Kuhlmann.
Thank you for having me here.
Yeah. So if the kidney is affected, the body gets problems getting rid of toxins, and sometimes years can go by before the patients notice. But surely there must be some kind of warning signals.
Well, actually, for starting kidney disease, you have very few warning signals because kidney disease doesn't hurt. And if something doesn't hurt, you don't realize that there's something. If you want to know whether your kidneys are healthy, then the best to do is to check the urine, because the first signs of a kidney disease you can find in the urine, and that is the excretion of protein or blood. If the other signs are, for example, blood pressure. Kidney diseases cause high blood pressure. And if you have high blood pressure, so why don't you check your kidneys? I think that's a recommendation we as nephrologists give to all our patients.
So there's no way of reading somehow on your body, in your face, anything that changes if there's something wrong with the kidneys?
Well, actually not in the early stages of kidney disease. You don't see that. In later stages, you can see that you get pale, you get kind of a grayish skin color, but that's very late stages of kidney disease. In early stages, you do the urine testing, and you can do some serum levels of a protein that is excreted by the kidney. And if this is increased, then it's an indication that the kidney function is getting worse.
What are the main factors that can damage or harm the kidneys?
The major factors in our world now are high blood pressure and diabetes. These are very popular diseases. So high blood pressure damages vessels, arteries, and the kidneys are full of vessels. So the kidney is one of the major target organs for high blood pressure. And with the diabetes, it's the same. It's a vascular disease, so the kidneys are in the focus of diabetes too.
Is it possible to properly regenerate?
Well, kidneys can regenerate after an acute injury. An acute injury is something that happens at one instance, and the kidneys are injured, and the kidneys have a high capacity to regenerate in those cases. But with chronic diseases, as we discussed before, the consequences of hypertension, of diabetes, here the kidneys cannot regenerate. In this case, you have to take care that you stop the progression of the kidney disease, and progression means loss of kidney function. As a patient, you can live with a reduction of kidney function quite well, even if you have a reduction to 50–30% of normal kidney function. You're not very much bothered by that. But we as nephrologists, we have to take care that the function is maintained and you're not losing the function until you have to go to dialysis. This is the goal of our therapy with the patient.
Now, high blood pressure is one of the primary causes of chronic kidney failure. What do you do to make sure that it doesn't go that far at all?
Well, you have to treat high blood pressure. And high blood pressure, to treat high blood pressure means to give drugs, to select the adequate drugs, to take care that the patient understands why he has to take the drugs and does he really take the drugs. In addition, you have some other measures like running, jogging, for example, the right nutrition, and the prevention of further acute kidney injury.
Now, in our report, we also saw that taking painkillers regularly has a very bad effect on the kidneys. What would you recommend?
Well, painkillers may really damage the kidney, either chronically or sometimes even acutely. And these are those painkillers prescribed for chronic back pain, typically. So we would recommend to take those painkillers only for a moderate period of time, not for a long period of time. The longer you take a painkiller, the higher the risk to develop some kidney damage.
Now, when the kidneys fail, what other conditions does that bring on?
When the kidney fail, you can see you get tired, you get weak, you lose your appetite, you lose weight, you get pale. So these are the signs that the kidney function is inadequate. And then we have to take the patient to dialysis or bring him to a transplantation. With dialysis, actually, you have to see a dialysis clinic 3 times a week, or you do it at home daily. You can do that. Transplantation gives you the opportunity to replace the kidney function in a much better way than dialysis does.
So what do you recommend doing to ensure that the kidney remains healthy?
Well, we recommend healthy nutrition. Healthy nutrition means Mediterranean diet, so fruits, vegetables, some amount of fresh fish and meat, but all in a moderate amount. And that's, I think, for nutrition. We do not recommend anymore to have a restriction on protein intake. This is kind of old-fashioned.
And that is also refers to one of the questions from one of our viewers refers to John Lang from San Francisco, California. He wanted to know what kinds of food and drink support a healthy kidney. And what about alcohol and cranberry juice? Cranberry juice is always said to be good for the kidneys. Is that true?
Well, alcohol actually is toxic for the liver. So even if it may be good for the kidney, I think you want to save your liver too. With cranberry juice, it's good to prevent urinary tract infections.
Okay. Dr. Kuhlmann, thanks very much for being with us on
You're welcome.
In Good Shape today.
It was a pleasure.